when you forget what you're saying mid-sentence. This happens to me all the time.
There's more than 50 definitions of concussion, which we'll show you in this model in just a minute. Let's see what's going on in that frontal lobe. And with that in mind, we just did a brain map on you.
My first question is short-term memory loss. When you forget what you're saying mid-sentence, this happens to me all the time. Happens when I'm talking to my wife. It happens when I'm on camera. It actually went away for a couple months after I did my psychedelic treatment, and now it's back. What is that?
Well, it's difficult to say what it is, but we can talk about why it might start coming up. And so, and this is just an idea, because whenever I'm talking with somebody about a particular symptom that they have, a condition, something they're suffering with that they'd want to improve, like this, where we're losing focus, it would seem, on what the subject we're talking about. So we have to start thinking about just regions of the brain, networks of the brain. So we know that speech and memory, we know where those areas kind of lie in the brain, in the landscape. Speech for men is mostly on the left, the ability to understand what you're saying and me to interpret it, and then speak back is mostly left brain with men. Women tend to be bilateral, so they recover better from strokes, their speech, if so. But in memory is in another area, a little bit lower in the temporal lobes, which we'll show you in this model in just a minute. But we're having kind of a disconnect in the ability to maintain the thought, the working memory, which is what we're talking about here. It's not long-term, it's short-term. It's like right now, right now, right now. And being able to keep that short-term memory in the forefront. So I'm thinking, when I hear that, I'm thinking, okay, what's happening in the frontal lobe, the dorsolateral prefrontal cortex? I'll use language that's more scientific just because it's in my wheelhouse all the time, but I'll kind of try to break that down a little bit. So the frontal lobe, it's your executive function. It's like what's happening right now, making decisions and organizing your thoughts. Maybe you're thinking even about the next question you want to ask me. It's all happening in that frontal.
Okay.
But maintaining what I just said or what you just said is also happening between the frontal, the temporal lobes, and so networks come together. So when we think about it, I first think, what's going on in this person's brain that might be now projecting this effect? So I look at it more globally rather than thinking, let's just work on their speech or just their memory. I want to see globally what's going on. So I have to take a step back from really every symptom. Even if I have 5 people with the same symptom, 3 men and 2 women, I still have to take a step back and look at their brain as a whole to understand what might be the causes, what might be contributing, what might be the therapies for them afterwards, if we can do something, right? Because that's something we talked a lot about. People go and they get assessments, high-tech scans, and then they just don't know what to do with that data to help themselves. It's like it confirms you have a problem. Good, that is helpful. It lowers anxiety. Yes, I have this problem. But what am I going to do with that? Or can I do something with that? So my answer is, to what is that, we wouldn't know until we started to get in there and start to work with some of the structures and see, can we alter that? But I would first put my pin in working memory in the frontal lobe.
Okay.
I'd like to say, okay, let's see what's going on in that frontal lobe. And with that in mind, we just did a brain map on you. So we did an EEG or a QEEG, right? I mentioned a EKG for the heart. An EEG is done for the brain. Well, we did a QEEG. It's a version of that where we can look at a brain map.
Okay.
And we got some results from that, which would tell me, oh, okay, this might be something that's going on in your brain that might be contributing to that issue that you're talking about.
Okay. What are a few specific things that could be triggering that? Like, could it be a traumatic brain injury? Could it be
absolutely
TB or PTSD?
Yeah,
it could be
both together. Yeah. So anytime we have a mild, and there's more than 50 definitions of concussion. So this is and they just came out of the conference, the consensus conference earlier this year in Amsterdam and they do this every few years to try to understand what's the current data, what's the current understanding. So when people think they have a concussion, generally a person thinks it's more mild compared to a MTBI, a minor traumatic brain injury. That seems more, ooh. And anyone who's in the military, who's served, has heard enough rounds going off, had enough things that could have created multiple concussive forces to the brain, and then changed the electrical activity, the chemical activity in the brain, that could contribute to those. So absolutely.
Okay. Could it also be from ADHD, ADD, maybe just having too much going on at one time?
Yeah, for sure. I mean, we were talking about this the other night, that a lot of times people have these subsequent conditions. A person would say, I have ADD or I have ADHD, or my child. And then they have a concussion and they had ADHD before that. Or they had anxiety and they had a concussion or a brain injury after. So you can have different things that can occur, but you have these underlying conditions.
Okay.
So I guess I could say, like, if I'm training for the military, but I previously had a knee injury and I had a back injury when I was a kid. Now I'm training and now I flare up some of these things, and now I have a bigger problem with my knee and my back, and now it's my shoulder because I brought to the party already an imbalance or something that wasn't strong when I brought. And neurologically, that happens to a lot of us. We have a trauma as a kid. We have some sports. We have some injuries. We get really ill at one point. We have the inflammation from things. We have a poor diet. And we bring all that stuff to the party of whether it's a brain injury or whether it's PTSD and exposure to something that's really traumatic. And now our brain is working on top of all that other stuff in the background. So, yes, I mean, the different conditions or symptoms that people have are really a picture of what's happening in their brain.
Okay.
Hey everybody, I'm Shawn Ryan. Click here to subscribe to the Shawn Ryan Show YouTube channel for the hottest and most compelling interviews that you will not see anywhere else. I've also made a playlist of all the previous SRS episodes so they're easy to find. You can find that right here.